Hi, I'm Kathy McAdory, and I'm here to talk to you today about antipyretics. Drugs that are included in this class are actually three different classes. It's salicylates, which is aspirin, NSAID, which would be ibuprofen and naproxen, and acetaminophen. My action class for this drug is that this is a COX inhibitor, and the therapeutic effect of this medication is it allows the hypothalamus to override the prostaglandin-induced increases in temperature, otherwise known as fighting a fever. Pharmacodynamics of this medication are that it works to inhibit the synthesis of COX-1 and COX-2 and prostaglandins. It also halts the effect of interleukin-1 and prevents the brain's increase in endogenous pyrogens. Pharmacokinetics are that it is absorbed through the stomach and intestinal mucosa. It is distributed through blood plasma, and the metabolism is through liver and kidney. Excretion is through urine and bowel. Pharmacotherapeutics are some of the precautions. Let's talk about we need to monitor our total dose. And remember, ASA is not for use in children because of Reye syndrome. Contraindications would be allergies, GI bleeding, liver or kidney disease, and some adverse drug reactions. It can cause GI upset and bleeding, thrombocytopenia, and of course allergy. Some drug interactions are ASA increases serum nitrate concentrations and phenylalanine levels. Some of the clinical indications would be fever. Our rational drug selection, we always need to remember when we have liver disease, not to consider acetaminophen. When we have kidney disease, not to consider ibuprofen. And if we have any bleeding disorders, never to consider ASA. Things we would like to monitor would be lab values for liver panels, BUN and creatinine, and platelets. And we also would want to monitor our 24-hour dose limits, and then also for signs and symptoms of bleeding. Some patient education. We need to remember this. This can be administered PO, IV, or rectally through suppositories. Some lifestyle management. We need to be sure we educate our patient to not take acetaminophen-containing narcotics in conjunction with acetaminophen products for fever. We also need to monitor total dosage of any antipyretic to avoid overdoses. We need to take NSAIDs and ASA with food to avoid GI upset and to definitely know and educate our patients on the signs and symptoms of bleeding. So our main takeaways. Remember, fever can be good. It allows us to form antibodies. Avoid Tylenol with liver disease. Avoid ibuprofen with chronic kidney disease. Avoid ASA in children or those who have bleeding disorders. And encourage patients to monitor total 24-hour dosages.